About drugs acting on smooth muscle cells and how they cause relaxation of smooth muscle. So the first thing we'll talk about is by increasing cyclic GMP levels, cyclic guanosine monophosphate levels. So CGMP, if you look at it, it dephosphorylates myosin light chain. By dephosphorylating the myosin light chain, you cause muscle relaxation. So you remove the phosphate group from the myosin, and the myosin won't do cross-bridge cycling over there. Now, CGMP is made by guanylyl cyclase, okay? And it is inhibited by the enzyme phosphodiesterase. So you want to get rid of CGMP, then what you do is you give a little bit of phosphodiesterase you give a little bit of phosphodiesterase. So that will inhibit muscle relaxation. Remember, phosphodiesterase enzyme inhibits muscle relaxation because it inhibits the formation of CGMP. It lowers the CGMP levels. Now there are drugs that inhibit this inhibitor of relaxation, hence causing relaxation, like phosphodiesterase inhibitors. Example, Viagra, also known as sildenafil. Now Viagra, I think many of you will know about it. It inhibits phosphodiesterase, so allowing the smooth muscle to relax. Where is this smooth muscle going to relax? Number one is in the cavernosal region of the penis. So it will allow for dilation of blood vessels in the penis and a proper strong erection to take place. So it is used in erectile dysfunction, but you don't want to give it to a person with angina, with chest pains due to narrowed blood vessels in the heart, narrowed coronary vessels. That would actually be very dangerous for them, because especially when these patients are on nitrates, to again cause vasodilation. If you add Viagra, it will really dilate their heart vessels so much that they would actually have very low blood pressure in the coronary vessels, and there won't be enough perfusion, and the heart will die. They get these things called pale infarcts. So pale infarcts, right, in angina patients who are taking nitrates. So if somebody is taking nitrates for their angina and they take sildenafil, they can actually die. They can actually get a heart attack and pale infarcts because there's not enough perfusion. So the infarcted tissue looks pale, and all the blood goes to other blood vessels which can dilate more. So let's say there's a blood vessel here, it's narrowed, there's another branch over here. So because this blood vessel is narrowed, vasodilation happens in other parts and more blood goes somewhere else and not to the tissue which has to be perfused. So there will be less perfusion, low blood pressure over here, and it will cause death of this tissue in the heart. Okay, so just let's go over that again. So there are two branches of vessels, just imagine, and you have a little bit of blockage over here. Now you give nitrates, and on top of that Viagra, you really dilate all these vessels, but the diseased part of the vessel does not dilate. So this part does not dilate, and all the blood goes somewhere else. So what's going to happen? Less blood pressure where it should be. So that causes heart attack. You also give this for pulmonary vessel relaxation, sometimes in congenital heart diseases of babies. So babies are given Viagra at times to relax the smooth muscles in the pulmonary vasculature, causing reduction in pulmonary hypertension. So then after that, increase in nitric oxide levels. This is done by taking nitrates or nitroprusside. This will release nitric oxide, which will cause relaxation of the blood vessels, used in conditions like angina. By exercising and eating good healthy foods like dried fruits and nuts, you are going to get an increase in nitric oxide levels in the body, causing smooth muscles to relax in the blood vessels. Blood pressure will be nice and under control also. Next, remember, when you increase calcium levels in the cytoplasm, you are going to get more contraction. So if you reduce the calcium levels in the cytoplasm, you are going to get relaxation. So we have drugs like calcium channel blockers, CCBs, abbreviated as CCBs. If you give those, you block the calcium channels which allow calcium to enter into the cell. So effectively, you are going to tell the muscle not to contract. Now, the effect of calcium channel blockers, there are on two types of tissues, smooth muscle and cardiac muscle. So if we look at smooth muscle, it causes relaxation of smooth muscle, especially in blood vessels. There's a special class of drugs that specifically target the smooth muscles, meaning the calcium channel blockers that affect mostly the smooth muscles in your blood vessels. And these are the dihydropyridine class of calcium channel blockers. They end with the word dipine, D-I-P-I-N-E, like amlodipine, nicardipine, nimodipine, cilindipine. All these words end in dipine. So these dipines cause a dip in your blood pressure because they relax the blood vessels and cause vasodilation. You can also give them in other conditions like in migraines. Cilindipine has a role to play in that, and hypertension. So that's more to target the blood vessel diameter and the blood pressure. However, if you look at cardiac muscle, they also have calcium ion channels over there. So like in your pacemaker tissue and this one cardiac muscle, you have calcium channels. And if you look at the calcium channel blockers that work over here, they are named diltiazem and verapamil. They are more cardioselective. They don't work too much on blood vessels, so they tend to slow down the heart. They affect the rate with which the heart would work, and also meaning the pacemaker and the cardiac muscle, how fast and how slow they would cause the heart rate to take place. In this case, they will cause bradycardia. Okay, so they are given in some conditions, certain anginas, where you get chest pain due to narrowed blood vessels. If you slow down the heart a bit, you can actually reduce the heart rate and reduce the oxygen demand by reducing the heart rate. Then you can also stabilize the membrane potential. So the membrane potential, how do you stabilize that? Remember, it's always fluctuating and depolarizing, repolarizing. If you can get rid of potassium more from the cell, increase potassium permeability, the potassium leaves the cell, then what happens? You are losing cations from the cell, and this cell becomes more negative. So how is that done? There are drugs like minoxidil and nicorandil. Minoxidil is going to block your is going to open your potassium channels and allow more potassium efflux. So this will reduce depolarization of the cell. So where do we use minoxidil? This is used in conditions like where you want to relax the blood vessels and dilate them, especially in areas like the scalp. So for the scalp region, by giving it, putting it on the scalp, applying it on the scalp, you can actually dilate blood vessels, and that helps in hair fall. It reduces hair fall by providing more blood supply to the scalp area, and helps in reduction of hair fall. So usually people who are suffering from alopecia for whatever reason, actually alopecia is more complicated. It has a lot to do with toxins in the food, lots of fatty acid consumption, and a lot of stress that people take and lack of sleep. So it causes tension around the muscles of the head, like the occipitofrontalis muscle. So you have this muscle on your scalp. If this are your ears, your nose, eyes. So here's your hair. Okay, just excuse me, the diagram's horrible, but there's a muscle over here, and blood supply goes through this muscle. If you tense your muscles a lot from tension, from thinking too much, what happens is the blood vessels get squeezed. So that doesn't help a lot. That's why massaging your head also tends to help in improving blood supply. It relaxes the muscles and allows more blood supply to the scalp. So people use an oil massage once in a while, and that actually does help with the hair growth. Anyway, so minoxidil and nicorandil, they help in this alopecia, by dilating the blood vessels in the scalp. They were used also for like blood pressure effects and all of that, but mostly we use it for the scalp. It's not used for blood pressure that much anymore. Then you have modulating myosin light chain phosphatase activity. So remember, myosin light chain phosphatase causes smooth muscle relaxation. Now what happens is there's a G protein coupled receptor with an enzymatic effect called Rho kinase, and this inhibits myosin light chain phosphatase. So I spoke about Rho kinase also over here in our pharmacomechanical coupling over here. Rho kinase. What is this? This is G protein coupled receptor that inhibits myosin light chain phosphatase, which we know causes the dephosphorylation of the myosin regulatory light chain, causing relaxation, or it stops the cross-bridge cycling. That's what we don't want, further contraction to take place. And Rho kinase inhibits the relaxation, meaning the myosin light chain phosphatase from working. So what happens is, if we give a drug to inhibit Rho kinase, you can actually allow the myosin light chain phosphatase to work better. So Fasudil is a drug which inhibits Rho kinase, allowing for the better relaxation of smooth muscles in the coronary vessels of the heart, allowing for better blood supply to the heart, dealing with angina complaints, and also in the blood vessels of the lungs. So if a person has too much tension in the lungs, that's pulmonary hypertension. By the way, how do you get pulmonary hypertension? So your lungs, if you see the blood supply in the lungs, they have something unique. Let's say this is an alveolus, okay, and this is the blood vessel that's taking blood across the alveolus. If this alveolus is damaged, what happens is there's no exchange of gas taking place, no oxygen coming in, no CO2 going out. So what's going to happen now is there's no trade, no exchange happening in this blood vessel going to this alveolus. It's a waste. So the lungs blood vessels are different. In response to hypoxia, they actually cause vasoconstriction, so that you can shunt the blood. So instead of going down this road where there is no shopping, no business happening, imagine this is a mall and there's no shops in this side of the mall, you would seal that off, so the people can go with their money to another corridor in the mall, and they can do some trade with some healthy alveoli where oxygen can enter, and meaning goods and services, and CO2, like money, goes out. Think of it that way. So this is one of the things in our body. Now, if most of your lungs are damaged, the alveoli in your lungs are damaged, like in COPD, smoking, chronic bronchitis, emphysema, bronchiectasis, or for whatever reason you've damaged most of your alveoli, what's going to happen is all of your blood vessels, many of your blood vessels are going to constrict because most of your alveoli are damaged. So what's going to happen? The pressure is going to be a lot in the pulmonary vasculature, and that's going to pressure your heart later. So your right ventricle is going to undergo a lot of pressure eventually. So this is going to damage your heart. This is called cor pulmonale. Pulmonary hypertension, due to the lung problems, eventually will affect the heart, causing right heart failure eventually. So that is our topic of the drugs that work on the smooth muscle. It's a little tedious in the beginning when we look at pharmacomechanical coupling. Let's just go over it one more time. When you increase calcium levels for whatever, in any way, by making extracellular calcium enter or intracellular calcium, mostly it's the extracellular calcium that causes the calcium rise to happen the most in the cytoplasm. Okay, intracellular calcium from sarcoplasmic reticulum is not that much. So the extracellular calcium sources are very important. They will cause increased calcium level in the cell. 4 calciums bind to calmodulin. This is the protein present in smooth muscle. So you make a calcium calmodulin complex over here, and this is going to activate myosin light chain kinase, and it is also going to phosphorylate calponin. Okay, and this is going to inhibit remove any inhibition on myosin ATPase activity. So the myosin head is over here, right? It has got ATP activity, ATPase. It will eat up the ATP and it will do a power stroke and all of that. So you want to remove any inhibition on this. So again, the calcium calmodulin complex plays a role over here. Right? Now, so all of this is going to cause phosphorylation of the myosin light chain kinase in the myosin neck. This will cause increase in myosin ATPase activity of myosin head, and binding of myosin and actin will take place now. So what's going to happen now? You will get a ratchet-like action, meaning cross-bridge cycling, and contraction will take place. So it generates the force of contraction. Then the thin filaments are pulled together because the myosin is going to pull the thin filaments together, releasing ADP and PI. And eventually, and this will keep happening as long as the calcium levels are high in the cytoplasm. And when the signal is gone, or the ligand is gone, or the action potential is gone, the pharmacomechanical coupling stops, and then you reduce the cytoplasmic calcium levels. And how does that happen? So calcium pumps like circa ATPase are going to take the calcium back into the sarcoplasmic reticulum, and 3 sodium 1 calcium exchanger is going to remove calcium outside. This is going to cause dissociation of calcium calmodulin complex, so the calcium leaves the calmodulin molecules. Eventually what's going to happen is another enzyme called myosin light chain phosphatase will get activated, the one that's blocked by rho kinase. Let's leave that for now. So when you activate myosin light chain phosphatase, it will remove phosphate group from the myosin regulatory light chain, and this myosin chain regulatory light chain, which was phosphorylated, is now, we remove this phosphate group. Now it cannot work, it cannot do another cross bridge. So what's going to happen now, you will get relaxation of muscle, or you will get latch bridge formation, meaning relaxation means the myosin will just let go of the actin, or it will stay stuck to the actin, but it will not do further cross bridge cycling, so it will maintain that contracted state for a long time. This is called latch bridge formation, where the myosin clings on to the actin. So it gives you sustained contraction with minimal ATP expenditure. You're 100%, 100 times more effective in terms of smooth muscle compared to your skeletal muscle in terms of that way. And just be aware that the tension that is created by smooth muscle per cross-sectional surface area is going to be double of that created by skeletal muscle. So if a skeletal muscle makes 2 to 3 kilograms per centimeter cross section of the muscle, the smooth muscle will make around 5 kilograms of per square centimeter cross section of the muscle. So you see the muscle, you cut it and see how many square centimeters are there, and you can calculate how much is the force generated. That's why bigger, bulkier muscles tend to be or are supposed to be a little stronger. There are other ways to make stronger contractions, more efficient ones. Size is not everything, but size is a rough estimate of how good something can function in some situations, not everything. Anyway, I'll see you later.